HPV vaccine is recommended for? The right option is option C. Girls aged 9 to 14. Photograph is used to monitor. The right option is option B. Labor progress. Naegele's rule is used to estimate. The right option is option B. Expected date of delivery. Management of severe preeclampsia at 34 weeks. The right option is option C. Terminate pregnancy. Menorrhagia means. The right option is option C. Heavy prolonged bleeding. Which is a live vaccine contraindicated in pregnancy? The right option is option C. Rubella. Oligohydramnios refers to amniotic fluid less than. The right option is option A. 500 ml. The hormone that causes milk letdown. The right option is option B. Oxytocin. Episiotomy is given to prevent. The right option is option C. Perineal tear. What is the safest method of contraception postpartum in breastfeeding women? The right option is option D. Progesterone only pills. Chocolate cyst is seen in. The right option is option C. Endometriosis. The most common cause of infertility in females. The right option is option B. PCOS. The normal duration of menstrual cycle is. The right option is option A. 21 to 35 days. Clue cells on microscopy suggest. The right option is option C. Bacterial vaginosis. Pap smear is used to detect. The right option is option B. Cervical cancer. Bartholin cyst is found in. The right option is option B. Labia minora. Hagar's sign is seen in. The right option is option A. Early pregnancy. The most common gynecological cancer is. The right option is option B. Endometrial. Kegel exercises are advised to. The right option is option C. Strengthen pelvic floor. Which is not an indication for C-section. The right option is option D. Normal labor. The most reliable sign of pregnancy is. The right option is option C. Fetal heartbeat on Doppler. Quickening is felt around. The right option is option B, 16 to 20 weeks. Apgar score includes all except. The right option is option D, blood pressure. Most common cause of abnormal uterine bleeding. The right option is option B, PCOS. The most common site of ectopic pregnancy. The right option is option C, fallopian tube. The first stage of labor ends with. The right option is option B, full cervical dilation. Preeclampsia is characterized by. The right option is option A, high BP proteinuria edema. The best method to confirm pregnancy is. The right option is option B, ultrasound. Which hormone maintains pregnancy? The right option is option B, progesterone. Postpartum hemorrhage is defined as blood loss of. The right option is option C, 500 ml vaginal, 1000 ml C-section. Which tumor marker is associated with ovarian cancer? The right option is option A, CA125. The ideal time for first antenatal visit is. The right option is option B, 6 to 8 weeks. What is the normal fetal heart rate? The right option is option B, 110 to 160 bpm. The most common position during labor is. The right option is option A, occiput anterior. Primary amenorrhea is absence of menstruation by age. The right option is option C, 16. Postmenopausal bleeding is. The right option is option C, need investigation. Risk factor for endometrial cancer. The right option is option C, unopposed estrogen. Amenorrhea with glycoria suggests. The right option is option C, prolactinoma. Eclampsia is best managed with. The right option is option C, magnesium sulfate. Molar pregnancy shows which sign on ultrasound? The right option is option A, snowstorm appearance.